Good afternoon. It is Thursday, March the 18th, 2021. Seiko, David Lahashu Juts, and welcome to today's edition of the COVID-19 Task Force Update on this, our 191st edition of Kahnawake 911. On today's program, we'll hear from Robin Delaronde, Executive Director of the Kahnawake Education Center, and Lisa Westaway, Executive Director of the KMHC. And to kick off our show today, here is Robin. Robin?
I'm pleased to be here with you all this afternoon to give you all just a general update in terms of what is occurring in the education of our students and at our schools. The first thing I would like to say is that I would like to just bring everyone up to date in terms of how we're responding to situations as things evolve. I want to first let people know that at this time, some of you as parents and who are enrolling your children in school are aware that we have passed what we have as norm, our registration period. At this time, it normally closes in February. And these are very crucial times in terms of, more so in terms of making a choice in terms of where your children go to school. Registration period, enrolling your students in our schools in normal sense, allows us that opportunity to be able to make projections in terms of class sizes, the amount of resources and teachers that we require in order to support the children and so forth. So that allows us to be properly prepared for the September opening of our schools. Even more so right now, it is so important that as parents, you, if you haven't already done so, that you make your choice and you fill out the registration forms in terms of the school that you want your child to enroll in the Kahnawake education system. It's important because, as you're quite aware, is that we have had to make immense adjustments in terms of how we support students and the type of services. Our classroom sizes this past year have been limited in terms of the capacity of the norm of what we normally enroll and allow for in our classes, where at times where it has been 18, we have been cut down to class sizes of 12. We all know that we can't foresee in terms of what September will entail in terms of class size. We all are quite aware and quite happy that we've begun the vaccination in our community. And we have many good things to look forward to. But we still know that there are still some variables. We have the variant, and there are still some possibilities that we may have to continue to make some modifications to what we have as a norm within our schools in terms of class sizes, services, and so on. So once again, I encourage you as parents, if you have not already made your choice in terms of what school you want your child to attend, whether it may be a school within the KEC or even Gariwanoru and other schools, Indian Way, even outside of the community, that it's so important that you make that choice for proper planning and services. So if you haven't already done so, please do so. One of the other things that I know parents may be asking at this time of year, like we were last year, is what will graduation look like? What will celebrations for our 11s look like? Those were key important points in a young child's education career that we all want to celebrate, that we all want to acknowledge. And I do want to reassure you that we are taking into consideration and already thinking about what those plans might entail. We have to be, and you must understand, we must continue to be cautious and mindful that even though we have the vaccines and a good portion of our communities beginning and has begun that process to get vaccinated, that there still are the measures that we must still follow. We must still be cautious. And in any planning that we're going to review and look at, we still have to keep that into consideration. So I do want to reassure you that we are thoroughly reviewing the plans for any graduation ceremonies for our students. The other things that I wanted to speak about today is that also letting you know that in the Kahnawake Education Center, this is the time when we do look at and plan for staffing. We do look at our staff members in terms of how many staff we need and so forth. And, you know, we are well underway with looking at what would we be doing in the norm. But we are also looking at and thinking about options in terms of alternatives. So I do want to reassure you that we continue to look at not only immediate needs, but also we're already looking at, in terms of September, you know, what would things look like? What would class sizes look like? Will there be a change in terms of class sizes now that students, or not students, but our population has received the vaccinations? What will occur? Will we be allowed to have more students and so forth? So we have all those questions, but like everyone else and across the world, you know, right across the world, we don't have all the answers. There's still a lot of things that we don't know for sure. But we are making plans to make sure that we have plan A, plan B. We are taking so many things into consideration. So I really did want to reassure everyone that collectively that we are going to be looking at many alternatives for students. I really hope and had wished that I would have more details to provide, but I wanted to keep it general, but to reassure you of what we are looking at. I also want to advise parents, in case some didn't know, or community members, because our parents do know, is that we have had changes in our schools specific to masking. What has occurred is that prior, our teachers obviously wore masks, cloth masks, various masks to protect when they came into the premises. But at this time, our staff and our teachers have been provided with 2 level 1 masks that they change throughout the day, 2 times during the day. So we've made some adjustments to that. In addition, we made those adjustments to students from grades 5 to the high school, where they too, upon entering the building, receive the 2 masks daily to wear that they're required. If any visitors, we do limit the amount of visitors in our school, but if anyone does come into our schools, they too are required to wear the cloth masks. And as we're seeing, there's always things that are changing. There's going to continue to be some changes. So we will be providing further information regarding masking to our parents as we get the information and updates as to what is best for all our students, our teachers, and our schools. One of the things I would like and would recommend to parents is that at the younger age, I really would recommend that as we prepare for September, I'm pretty certain, and I think we all are, that masking will continue to be something that we're going to continue to need. And I would advise that even at the younger ages, whether it's nursery, kindergarten, and 1 and 2, that start preparing your child to be accustomed to wearing masks. Start getting them used to that in terms of preparation for coming into school in September. If that's something that they're not used to, it would make things better for the students and for everyone. Because as I said, there's so many different changes in terms of masking and requirements. So for today, I just want to say that, you know, that today was very general in terms of what is happening in education, what we're planning for, but just to let you know that all of these things are very important, that we are reviewing everything. We are looking at not only the current period, but the next few months, and we are already planning and looking at for what September will entail. So I just want to, you know, say that definitely education will be back on, because we do have a closing of the year and looking at some updates in terms of what people can expect before we close up our year. And we'll probably will have more reports or more detailed information about what parents can expect in the coming months. So thank you very much. I hope I provided some general thought and consideration for people to think about. But if you do have any concerns, questions, please contact the education system and the center, and we will get back to you with some answers. So Kahnawake.
Thank you very much, Robin. Next up is Lisa Westaway, the Executive Director of the KMHC.
Thank you. So I have quite a bit of information to give today. We'll first start with the task force meeting that we had yesterday. I'll just give a summary. What was very clear in the task force meeting yesterday was the discussion about loosening of measures now that the vaccination campaign is underway. There were three main areas that were highlighted as important, I guess, for community members, because as you know, we all represent community members here in the room. And three main areas were documented as important for us to look at and address for the community. And that's the first one and most important being with respect to visitation, both indoor, outdoor visitation, as well as visitation at KMHC, inpatient, T-Bell, ILC. The second element was the reopening of businesses. And the third is with respect to travel for EDC organization employees outside of Quebec, because as many of you are aware, especially those employees of the EDC orgs, nobody has been traveling outside of Quebec since COVID has started, with a little bit of a break and an allowance throughout Canada during the summer months. However, that was really short-lived. So those are some of the main discussions that we had yesterday and that we will be looking at over the coming weeks and months. So the word months may be distressing to some of you, so I just want to explain a little bit where that comes from and what the plan is moving forward. So we did, firstly, I would like, before I get into that, I'd like to talk a little bit about Dr. Gauthier's replacement. So Dr. Fuller is going to be Dr. Gauthier's replacement as medical advisor to the task force. This is really exciting news for us. Dr. Fuller is actually a public health physician and has been doing essentially what Dr. Gauthier has been doing here in Kahnawake. She has been doing it the same thing with the Cree Health Board since COVID has started, so 3 days a week over the past many months, as well as maintaining as much as possible her practice here at KMHC. And therefore, she's going to consult with us regarding issues moving forward, medical issues, perhaps not quite in the same way that Dr. Gauthier had. She may not be as involved to that extent because she will maintain other responsibilities. However, she is very available to the task force for all of our medical questions. So thank you, Dr. Fuller, for embarking on this new experience with us. So actually, we did have a first meeting with her today, and a lot of the elements regarding our present situation in COVID-19 were discussed with her in order for us to help us make decisions about moving forward in the present context of vaccination. Our vaccination campaign. So what we want to talk about is the fact that the variants are here and what that means for us despite vaccination. So there are many elements regarding the present variants that lead to some unknowns for us, that make it difficult still at this point to make very clear decisions about how we move forward. One of those elements that is still very difficult is vaccine efficacy against the variants. So there has been it has been identified in trials that the vaccines are effective against the variants. However, we do not know percentage or level of efficacy. That is being studied as we speak in live studies, and so we hope to get more information about that soon. The other element that is still unknown is the ability, once vaccinated, for people to transmit the virus people who don't have symptoms, so asymptomatic carriers, to transmit COVID-19 with these variants. So this again is makes it very difficult for us to establish level of risk regarding transmission of the virus at this time. It's not to say that we won't have this information shortly. As you know, all of Quebec and all of the world is going through vaccination campaigns, and this information is being studied across the world and is being shared shared, of course, between countries in order for us to be able to move forward as all of us with our day-to-day lives. However, what this tells us is that those three elements I spoke about, visitation, reopening businesses, travel, all of those things, we can't just loosen measures all at once. So it is clear, and it was clearly identified yesterday in the task force meeting, that Kahnawake is very different, because if we do achieve our goal of 80% vaccination rate, we will do so months before the communities that surround us, Montreal, Greater Montreal, Montérégie. And so it puts us in a little bit of a weird situation where we have some protection within the community, however, not necessarily completely in the cities around us. And that means that we have to, and considering the unknowns about asymptomatic spread, about vaccine efficacy against the variants, it means that we still have to maintain some level of measures in order to protect ourselves. And that's why we continuously say that even if you've had your first dose, your first vaccine, even after 3 weeks, you need to maintain measures of distance, hygiene, masks, and checking in on each other's well-being. However, well, actually, before I get into that, I'll speak again about the variants and the situation in Quebec. So right now, as of today, 30%, what Quebec is able to say is that 30% of the positive COVID-19 cases are a result of the variant. All of the hospitals within Quebec are tasked right now with analyzing hospitalization rates and how many of those hospitalizations are a result of the variant. What we can say that's been clearly identified is that the Jewish General, that they have stated that 20% of their COVID-19 hospitalizations are a result of the variant. And what we do know is that INSPQ has predicted that by April 1st, 50% of COVID positive cases will be as a result of one of those three main variants. And so, again, this is significant. These are high numbers, and although by having a first dose of the vaccine after 3 weeks, we do expect a 93% efficacy rate. The fact that we still don't know about efficacy against the variants and that we still don't know about asymptomatic spread makes it very difficult to loosen measures all at once without the potential risk of severe multiple outbreaks within the community. So, what we do know is that we want to focus on our personal contacts, on visitation, on our mental health, as we have with gatherings, 2 household gatherings. And so as a first step, over the course of the next week, we will be putting in place measures that will allow for visitation in a safe way, and a little bit loosening up a little bit the measures that we actually have in place beyond simply the 2 household visits. And so we'll get back to you with information about that next week. However, one thing that we do have some homework for all of you, and we do want you to start thinking about what your acceptable level of risk is within your family. We've spoken about this before. We spoke about it during the summer. We will always have some level of risk, but when we do start talking about visitation, knowing that there is risk of still getting COVID-19, and knowing that not all community members are vaccinated, we will be educating you and empowering you on being able to make safe decisions for you and your family about what is acceptable for you. So we'll talk more about that next week. However, one element that is really important is actually vaccination. And by being vaccinated, so risk actually involves many different levels, whether we're wearing masks or not, whether we are appropriately distanced, whether we have done hand hygiene, whether we have been vaccinated. And that vaccination, even first dose after 3 weeks, decreases our level of risk. It doesn't bring it down to 0 for all the reasons that I just explained, but it decreases our level of risk significantly when we make a decision to gather. So 2 people who have been vaccinated, who are wearing masks, who are appropriately distanced, can more safely gather together and even possibly hug, with some risk still, but it's more safe. Now, so I urge you to think about this when you think about whether you want to be vaccinated or not, because the idea of being vaccinated actually decreases risk significantly, not just for you as an individual, but for all of your loved ones, and will have to be taken into consideration when your family members or you make decisions about how you want to live your life in the future. And so, of course, we cannot force anyone to be vaccinated, of course, and we fully understand that. However, it is the safest, quickest way for us to be able to move forward. So speaking about vaccination is going really well. Everybody we speak to who passes through the site has nothing but positive experiences to tell us about. It's a safe environment, so for those who are afraid to leave their homes because they've been home for a year, and I know it's scary to leave, you can feel safe at the vaccination site, and that's what we hear from everybody who passes through. We just want to show you a little bit about where we're at as of yesterday, March 17th. So this is the table that tells you that 39% of our 18 plus are vaccinated. That's just over 2,400 people. And of course, our goal is 80%, but we'll be very happy if we reach higher than 80%. So our goal is really 100%, but 80% is acceptable and allows us to make decisions about loosening measures a little bit more easily than under 80%. So this is where we're at as of today. I know that we've had some on and off issues with our online booking system, but I urge you to not let that distract you from booking your appointments. Continue trying, call the KMHC numbers and book your vaccine. One thing that we do here is that people are waiting. They're waiting to see what happens. Well, we've gone through 2.5 weeks of vaccinations, and so if you're waiting to see what happens, well, your wait time is done, so you can book your vaccines now, because we're nearing the end of the vaccination campaign. So we expect to vaccinate with all of the Moderna doses by somewhere around April 10th. So that is coming up very quickly. We're already almost fully booked until Saturday. We've opened up Tuesday, and we expect those will continue to open up days as we move forward and as we fill up days. But we really urge you not to wait. Now is the time to book your vaccine. It's really, really important. Just a little bit of housekeeping. So many of our EDC orgs who have been to the Kahnawake site for their vaccination, they had originally received an appointment for their second dose at 84 days. So anybody who received an appointment for their second dose at 84 days, their appointments are automatically canceled. You probably will receive an email or a text message telling you that your appointment is canceled, and it's all in French, the message that you receive. So in fact, what that message says is that they're asking you to rebook your appointment at 112 days. As you know, and we've spoken about here on Facebook Live, on the radio, the actual delay between first and second dose is set for 112 days, and therefore that is when the systems will allow you to book your second appointment. At our site here in Kahnawake, we are also giving appointments for second dose at 112 days. Some of you who came in did not receive your appointment for your second dose. Not to worry, it will be booked, and we'll be giving you information about when or how to do that on Click Santé. However, at this time, 112 days is the established time frame between first and second dose, and studies demonstrate that effectiveness of the vaccine, antibodies do not decrease within that time frame, and that's why they've chosen that time. The last thing that I would like to say about vaccination is really just a reminder that trials showed that a healthy young adult would develop antibodies at 14 days, but what we're really seeing is that it's closer to 21 days. So really, when we talk about any possibility of lowering risk, loosening measures, we're really looking at 90 days. We're really looking at those 3 weeks after first dose, and of course 2 weeks after second dose if is even higher efficacy rates. So I will go to testing. This is the last subject that I want to talk about. So where are we at right now with testing? Testing is still important, and in fact, I just want to do a little shout out to our testing site who continue to work hard every day to be able to meet the testing needs that we have. We are testing individuals with symptoms, and we are also doing asymptomatic or systematic screening for our employees of inpatient T-bell and ILC, as well as for natural caregivers who are coming in to visit their loved ones. So we have had a total of 108 positive cases since COVID has started. Presently, we have 0 active cases. Again, remember, it doesn't mean that nobody has COVID in the community. It means that of those tested, all of the COVID tests were negative. Since the beginning, we've had 2 hospitalizations. Those hospitalizations were more recent. However, both people are released from the hospital and are doing well, and we have had 0 deaths within the community. We've done a total of 2,175 tests, and right now we're testing approximately 5 to 10 people per day. So the important information that I want to give to you today is that even if you've been vaccinated, you may need to have a COVID test. So that self-evaluation of your symptoms has to continue because of all the reasons that I explained at the beginning of this broadcast, that you could still get COVID. There is a percentage of a chance of getting COVID. So first of all, before you develop antibodies, you could have been exposed to COVID-19 just before your vaccine or just after. But even 21 days later, 3 weeks later, you could still develop COVID symptoms and have COVID, because there is a percentage of a chance that you could get COVID. And we, again, don't know how effective the vaccine is against the variants. So if you have COVID-related symptoms, stay home. That's the first step. Get tested, and then so that we can identify positive cases quickly. Reminder of some education that we did earlier on in the year is that the most effective way of limiting transmission of the virus is through identifying COVID-19 cases quickly, contact tracing within 24 hours if possible, 48 max, and people staying in isolation for the time frame, the 14 days. This is really important, and we continue to put importance there because we can still have outbreaks, we still can have transmission of the virus, and so we have to keep all of those elements in mind as we move forward. And so that's the way that we have control. So it's a lot of information that I gave today. You can rewatch this if it helps, so that you can get that information, understand it as clearly as possible, and not be shy if you have questions to call right to Incident Command, or to write a message on our Facebook page, because we do answer questions as they come in. We thank you for paying attention.
Thank you very much, Lisa. Just a couple of things before we go. We did make a special arrangement for those who need to book their appointments, who are cross-border workers or students. We have compiled that list, and Community Protection will be reaching out, Public Safety will be reaching out to you to confirm their appointment and to give you all that information. Also, another few things before we go. We are still carrying out those vaccines, as Lisa said, so please book when you can if you haven't already, and you can do so by visiting Kahnawake911.com/vaccine, or you can call the KMHC directly at 450-638-3930, extension 2295 or 2206. And of course, we're also showcasing our community vaccination testimonials, and if you'd like to submit yours, you can do so by sending your testimonial to questions@mck.ca, or you can also reach out via the Kahnawake 911 Facebook page and send that via Messenger. And that's it for our show today. From all of us here, Nyawagoa, Danu, Onagiwahi.
Chief Tanya Perron here, getting my vaccination today. To be honest, I don't usually get vaccinated, but these are unusual times. Thought I would step up, do what I needed to do, my part to protect my family, to protect the community, and to help get us out of this pandemic. So I encourage everybody to take the same step. Let's do this together. Let's get over this pandemic, and let's all get traveling again and seeing our families again. Nyawa.